At the end of this month, the minimum price for a unit of alcohol will go up from 50 to 65 pence. Rod is backing calls for the money raised to be collected from off-licences and supermarkets and reinvested in local addiction services.
We need to do more. I think we're missing an opportunity around looking at minimum unit pricing and looking at the money that generates and doing something really positive with it.
Ministers say the policy, which was first introduced in 2018, is reducing alcohol hospital emissions, and they've not ruled out a future levy.
Well, earlier this afternoon I put some of the concerns raised in Matty's report to the Public Health Minister, Jenni Minto. Minister, the highest number of alcohol-specific deaths registered in a year since 2008. That's just not acceptable, is it?
Any death as a result of alcohol is not acceptable. And that's why the Scottish Government is investing in alcohol-drug partnerships and also rehabilitation beds to ensure that people that are living their lives reliant on alcohol can get the right treatment.
It doesn't seem to be working, does it? Because if you look at the graph, it has gone down in the past, but it's gone back up to this record number. Have you looked at what happened when it went down to try and learn lessons there, the lowest number being 2008? Do you know what happened?
I think it's fair to say that alcohol use is something that's at a societal level, and we have to understand exactly why people are turning to alcohol. And that's why it's so important to work with local organisations, the alcohol-drug partnerships, to ensure that we understand why people are turning to alcohol. And I think it's also important that we recognise that people still have a stigma attached to being an alcoholic, and it's how do we break down these barriers to ensure that we can get the right people coming for support, coming for treatment.
So why do you think, do your figures show that people are increasingly turning to alcohol? And if that's the case, why is that? Do you know, so you can get to the bottom of this problem?
I think there's a variety of reasons, and it's whether it's escapism, whether it's something that they've been brought up with, something that's throughout their lives they've experienced. And that's why within my own constituency, there's a lot of work going on with peer-to-peer work, so people that have managed to stop drinking, and what support can they give, and recognising the benefits that has with people that are perhaps they can recognise where people are with their dependency.
In your statement in a media release, you said that Scotland's world-leading minimum unit pricing policy has saved hundreds of lives, and you say there's evidence for that. You could look at that another way, could you not? If the minimum unit pricing is saving lives, that surely must mean that potentially there could have been even more deaths were it not for that, and we're at a record high at the moment.
I think that's a very fair comment to make, and I think that just shows the importance of ensuring that the Scottish Government is introducing sustainable policies, and minimum unit pricing is one of them. And as you'll know, that at the end of this month it will increase from 50 pence to 65 pence.
We've spoken to Rod Anderson, who's the CEO of something called Recovery Coaching Scotland, deals with people who have serious alcohol problems. He thinks that minimum unit pricing should effectively become a tax. It's not quite a tax, it's slightly complicated, but it's not. The money doesn't come to the government. He believes that the money should come to the government, and that money from minimum unit pricing should then be used for further programmes to tackle alcohol abuse, I suppose you would call it. Is that something you would consider?
I think that's an interesting proposal, and something that I would be very happy to look at.
Because at the moment the retailers, it's benefit, and the retailers, some of them object to it already. So the idea is you have some kind of tax on alcohol that then gets money to the government, which then it can be used. You're certainly prepared to look at that.
So I think it's important that the Scottish Government works with retailers as well to understand how it's operating for them as well. But certainly when we have the current situation with 1,227 deaths due to alcohol, we have to look at whatever options there are.
If you look at the figures, and the figures from the official figures show that although the gap has narrowed, Scotland still continues to have the highest alcohol-specific death rate of all the nations, countries in the United Kingdom. It's a similar pattern in drugs. Again, why do you think that is? And can the Scottish Government do more?
I think any government can do more when it's looking at the most vulnerable in their societies, which is why I'm pleased that the Scottish Government has invested the 112 million into alcohol drug partnerships and also the 100 million into rehabilitation beds as well. I think we've got to recognise as well, though, the wider financial constraints, and the decisions that the Scottish Government have made is not to reduce the funding into these areas, because we recognise that we need to support those in society that need the support most. And perhaps then there's a plea to the other governments, the Westminster Government, as to how they view this support, this funding. So I think there is an opportunity for a four-nation review of this.